Joining me now is my panel, Dr. Uche Blackstock, founder and CEO of Advancing Health Equity and a Yahoo News medical contributor, as well as twin sister, Dr. Oni Blackstock, founder and executive director of Health Justice, and Dr. Fatima Cody Stanford, obesity medicine physician at Massachusetts General Hospital and Harvard Medical School. Welcome to you all, guys. Very much appreciate you joining me this afternoon. This is an incredibly important conversation because as we talk about disparity in communities of color, I mean, there was a major disparity leading into this pandemic. Dr. Stanford, I want to bring you into the conversation here because there's also this psychological distress, right, that has been highlighted throughout this entire pandemic, and it is a mistrust in the medical system. It is a mistrust in Black Americans feeling safe when they're going to the hospital and feeling trusted about how they are feeling and what they are feeling. How do you combat this?
Absolutely. First of all, I want to thank you for being here with the twins. I finally get to be on with them, so this is a delight. But when we look at this issue surrounding distrust within the community, I think it's important for us to recognize that we've always thought of historical atrocities as being paramount to why the Black community currently feels this issue with distrust. The problem is that we are dealing with distrust and racism every single day of our living lives. And when we go back to those historical atrocities like Henrietta Lacks or J. Marion Sims or the Tuskegee experiment, we're discounting the everyday experiences that then lead people not to trust the healthcare setting. I think it's important for us to note when you look at the numbers that have been previously displayed that we're seeing this disparity. And what we should note there is that we're looking at primarily healthcare providers who are at the front of the line to get vaccines. So even in healthcare settings where we're the physicians, nurses, and other healthcare providers, we're seeing differences in who is choosing to get vaccinated. That says a lot about trust, even within the system, amongst healthcare workers. We don't trust the system because we're experiencing racism every day. We need to do better.
All right, Dr. Uche Blackstock, Dr. Oni Blackstock, and Dr. Fatima Cody Stanford, thank you all for this great conversation. We do, in fact, need to continue it because it is not going anywhere, the disparity that exists in our healthcare community when it comes to Black Americans. Thank you, guys. Appreciate it.